And what do we do at Morehouse School of Medicine? Well, we exist to improve the health and well-being of individuals and communities. We have a unique focus on medically underserved populations. We've done a great job in the context of research over the past couple of decades, really understanding the drivers of disparities, really understanding why African Americans are disproportionately impacted by almost every chronic condition in this country. So again, Morehouse School of Medicine is nestled on the west side of Atlanta in what we call the chronic belt. Here in this chronic belt, African Americans are disproportionately impacted by almost every chronic condition, including diabetes, cancer, as well as stroke. And I think we already heard some stats around cancer mortality as it relates to African Americans. So this lack of diversity, I think that has been alluded to in the former presenters' talks, is something that we have to begin to have real conversations around. We have to come up with real strategies that work to ensure that the candidate anti-cancer therapeutics are safe and effective for everyone who will use them if they are approved. That's the role of clinical trials. It is vital that the participants in the clinical trials testing the agents represent the entire population who may use them. In 1977, when tamoxifen came out, African American women were not as responsive as white women to tamoxifen. Would that have been identified if there was an adequate representation of African American women in that clinical trial that helped develop tamoxifen? Clinical trials also provide cancer patients the opportunity to receive the newest available treatments. And I think Dr. Bradley showed that in terms of when African Americans are included in clinical trials, the experience is the same. The outcomes are very similar to whites. But again, where are most African Americans treated? Is it in our robust, full of resources, NCI-designated cancer centers? No, it's in our community oncology settings that oftentimes do not have the infrastructure to run clinical trials. So a partnership is needed, a collaboration is needed. It's not a either or, it's an and. Better collaborations are needed with infrastructures that can run clinical trials. Thank you for your attention.